The influence of changing demography on healthcare needs of the northern province. It is becoming a gradually more and more hot topic. First of all, I will talk what are the significant demographic changes happened recently in the northern province and overall Sri Lanka. So we can look into three areas. First, we can see what happened until 2009 when the war ends, the war and war-related demographic changes, and then we see the post-war scenario, systematic demographic changes after 2009 to up to now, and then we can see what can be forecasted. Demographic changes based on all these trends. So during the wartime, we saw a net out-migration from the northern province, and a lot of people were going to south and then from overseas, and then the recent figures shows that actually people not remained in south, but they have moved out of the country. And then there were increased deaths, and increased deaths has become another topic which is under controversy. And we have seen that malnutrition led to large number of deaths in 2008 and 9, especially from the time that government started maintaining that there were only 70,000 people in Vanni and send food and provisions to that amount. And we saw that this kind of photographic evidence, and then how many people died actually during this time. So that the initial figures were from the statistics of the GA for the 4,29,000, and then we saw the people came out was 282,000. So therefore the missing persons 146,000, and the 40,000 figures by the UN, I don't want to dispute that, but as I going back, the deaths due to the malnutrition and due to lack of food could be the rest. And then immediately after the war, we saw this post-war scenario, systematic demographic changes. Immediately after the war, we saw that forced detention of the people for more than 1 year. And then there were systematic colonization by people from other areas to northern province, and also we saw that end of the war not removing the high security zones but expansion of high security zones, resulting in further eviction and forced migrations. And also we got with us large number of war widows, half widows and disabled, and we see that there's a systematic post-contraceptions. So this is what the government figure says, that government itself has acknowledged that there are 89,000 war widows and 49,000 in east and another 40,000 in the north, and there's a considerable amount in the fertile age group, and the government and our leaders are talking about making them self-employed, that they are trying to give some funds for rearing poultry or cattle or whatever, but there's no attempt to them to get back to the society and make them fertile or whatever. Then we have large number of half widows, nobody speaks about them, and these are people whose husbands have disappeared but not yet declared deceased. That situation continue, and they are unable to remarry and having serious psychological effects due to the prolonged unsettled grief, and they are seriously depressed, and this situation leads them to be again there's no scope for fertility. And then we come across this systematic attempt post-contraception steps. The last one which I directly got evidence was in September 2003, where this public health workers asked women to come to the government-sponsored nutrition clinic under false pretenses, and then they were coerced to take the implants, 5 years, subdermal contraceptive implant for 5 years at Jadalle, and in a clinic, nutrition clinic, they have put those without the consent of the husband, and there was no privacy, and everybody knows who have undergone the contraception. And the possibility of already pregnant was also not excluded, and that resulted in one maternal death, and all were now covered up. In the meantime, we see from 2009 onwards, the government promotes third child of armed forces with 100,000 while paying 500 rupees for sterilization of others, especially in the region of estates. Then there are other factors affecting the fertility of Tamils. The age at marriage has gone up, and the economy is dwindling, and there is a marital squeeze there because a lot of men have migrated and died due to the war and went on missing, so therefore the age appropriate females cannot find suitable partners. So there's a serious marital squeeze. But on the other side, among the diaspora, you might see the other way around. There are a lot of males, but there are no suitable female partners. And we see that the social issues have come back in a more dangerous or serious way. The dowry has gone up, and then again that we have started dividing ourselves in caste, region, and regionalism and astrological belief, which all affects the marriage and fertility in a serious way. So then what are the forecasted demographic changes we are facing? So this is what you can see up to now. 1911, the first point I have taken, because the first time the Tamils were divided into Sri Lankan Tamils and in Indian Tamils origin. And you see that that time the Sinhalese were 66, Sri Lankan Tamils were 12.8, and Indian Tamils 12.9, and Muslims 5.7, and others were 2.38. Then over the time you see the Sri Lankan Tamils and Tamils of Indian origin gradually decrease, and the sudden decrease in Indian Tamils were attributed to the 1940, where they were made non-citizens, and half of them, or large amount, were sent back to India under the Sastri Srima Pact. And then this trend continues. You see that by the systematic attempts, and then Sinhalese increase, but the Moors continue to increase rapidly, and others also have left the country, especially the burghers. Then we take the two major census points. In between you see that we had censuses, but there was war, and then there was some areas without government control. So I have taken only the two major points. This is all government record. You see that the Sri Lankan Tamils 12.7 in percentage in 1981, and it has come to 11.2, and then Tamils of Indian origin 5.5 has come to 4.2, and the Sinhalese population is increasing percentage, and you see the Muslims increasing. And then if we go on projecting these trends, this is what in the same picture in the graphical form, you see that the Tamils are decreasing, and then applying the exponential projection, the most likely projection that is applied for population growth. It is not the linear growth. For undergraduate students, you should know that the linear growth is not applicable for population growth. Here we use the exponential projections, assuming that the same growth rate continues. And then you see that the Sri Lankan Tamils become losing the first minority status in 2031 and so on. That will be reflected in the 2031 census, but that change takes place much earlier. You see that if we go through the annual projections, by 2028 the Sri Lankan Tamils will lose the first minority status. And now I am getting back to the overall Sri Lankan demographic aging pattern. You see that the blue line shows that Sri Lanka is rapidly aging among the other countries compared to almost all over the world. But within that, now Tamils will record the fastest aging population because the fertility has declined compared to other ethnic groups, and then our life expectancy also improving after the war. So I hope that we become very fast aging population, and the health ministry itself accept that our health systems are not ready to address the needs of an aging population, and that is that we don't have continuous or integrated care for the elderly that allows systematic screening for illness or disability, and many elderly patients who require secondary preventions are not getting it. So these are the general recommendations. There will be considerable expenditure on the drugs for the elderly, and then the facilities for chronic illnesses have to be increased. Heart disease, kidney failure, cancer, strokes, and sanatorium for bedridden elders, and expanding theatre and dialysis facilities, and increasing mental health programs. I am not going to much expand on what already Dr. Sivan has told. Only thing that there seems to be some new evidence coming up that the depression levels are going up in the context that the northern province, the people are not seeing any solutions. So what need to be done at this point of time? I think the fertility of Tamils need to be increased for optimal economical growth and sustenance, and also the healthcare facilities aiming at elderly and disability need to be strengthened and expanded, and mental health services need to be enhanced to cater the vulnerable groups, the special vulnerable groups, what we see with this post-war scenario, as well as what is being forecasted due to the aging population. I am in time. Thank you.